What if the simple act of breathing, something we do thousands of times a day without a second thought, became a constant, conscious struggle? For millions of people worldwide, this isn't a what if. It's a daily reality caused by a condition that quietly and slowly damages the lungs over many years. This condition is called chronic obstructive pulmonary disease, or COPD. It's a major cause of disability and death across the globe, yet it's often misunderstood and caught too late. In this video, we're going to break down everything you need to know about COPD. We'll explore what it is, how it attacks the lungs, and what the journey from diagnosis to treatment really looks like. Understanding this disease is the first most powerful step you can take toward managing it and reclaiming your life. So what exactly is COPD? The name itself gives us some good clues. Chronic tells you it's a long-term condition that's not going away. Obstructive means it blocks airflow, making it tough to breathe air out of your lungs. Pulmonary just means it relates to the lungs, and disease tells us it's a medical illness. Put it all together, and chronic obstructive pulmonary disease is a progressive lung disease where the airways are persistently blocked. This means, over time, it gets harder and harder to empty your lungs of air. This isn't like a cold you get over in a week. COPD is a condition you live with, and while some metrics have improved, the total number of people affected keeps climbing due to population growth and aging. It's a true global health challenge, with modeling studies projecting that the number of cases could approach 600 million worldwide by the year 2050. To really get what goes wrong in COPD, we first need to appreciate how healthy lungs work. Think of your lungs as a pair of large, spongy balloons. When you breathe in, air travels down your windpipe and into smaller and smaller branching tubes, called airways or bronchial tubes. At the very end of these tubes are clusters of tiny, delicate air sacs called alveoli. This is where the magic happens. These sacs are wrapped in a web of tiny blood vessels. Here, oxygen from the air you just breathed in passes into your bloodstream. In return, carbon dioxide, a waste product from your body, moves out of your blood and into the air sacs, ready to be breathed out. This whole system is incredibly elastic. When you exhale, your airways and air sacs spring back to their original size, efficiently pushing out that carbon dioxide-rich air. It's a seamless, effortless process your body performs all day, every day. Now, let's see what happens when COPD enters the picture. The disease isn't a single event. It's a slow, destructive process that usually involves two main conditions: chronic bronchitis and emphysema. And most people with COPD have a mix of both. Let's start with chronic bronchitis. That itis at the end of bronchitis means inflammation. In this condition, the lining of your bronchial tubes becomes constantly irritated and inflamed. Picture the inside of those tubes getting red, swollen, and narrow. The body responds to this irritation by producing way too much thick mucus, which clogs up the already narrowed tubes and makes it even harder for air to move. This is what causes that persistent, hacking cough that often brings up phlegm, a classic sign of COPD. Then we have emphysema. This condition attacks the tiny air sacs, the alveoli. Years of exposure to irritants literally destroy the fragile walls between these sacs. So instead of millions of tiny, springy bubbles, you end up with fewer, larger, floppy sacs that just don't work right. This destruction causes two huge problems. First, there's less surface area for oxygen to get into your blood. Second, the lungs lose their natural springiness. They don't bounce back when you breathe out, so old, stale air gets trapped inside, leaving less room for fresh, oxygen-rich air. That feeling of being unable to get a good, deep breath? Air trapping is a key reason. This 1-2 punch of narrowed, clogged airways from chronic bronchitis and damaged floppy air sacs from emphysema is what creates the persistent airflow blockage that defines COPD. By far, the number one cause of COPD is long-term exposure to things that irritate and damage the lungs. And the main culprit, responsible for the vast majority of cases, is cigarette smoking. But it's important to know that smoking isn't the only cause. Other major risk factors include long-term exposure to secondhand smoke, industrial dusts and chemical fumes at work, and air pollution both inside and outdoors. In some parts of the world, indoor pollution from burning wood or other biomass fuels for cooking and heating is a huge driver of the disease. There's also a less common genetic piece to the puzzle. A condition called alpha-1 antitrypsin, or AAT deficiency, can lead to COPD, often striking people at a younger age. AAT is a protein that protects the lungs, and if you don't have enough, your lungs are much more vulnerable. We also know that not every smoker gets severe COPD. which tells us that genetics likely play a role in making some people more susceptible to lung damage from smoke than others. Because COPD develops so slowly, the early symptoms are often subtle. It's easy to brush them off as just getting older or being out of shape. The main warning signs to look for are a persistent cough that might produce mucus, shortness of breath, known medically as dyspnea, especially when you're active, wheezing, which is that whistling sound when you breathe, and a feeling of tightness in your chest. As the disease progresses, these symptoms become more severe. Shortness of breath can start to interfere with simple daily tasks, like walking up a few stairs, doing housework, or even just getting dressed. People with COPD may also find they get frequent respiratory infections like colds or the flu that seem to hang on forever. In the later stages, unintended weight loss and a profound lack of energy are also common. If you're experiencing these symptoms and have risk factors, getting a clear diagnosis is crucial. The process usually starts with a good chat with your doctor about your medical history, symptoms, smoking habits, and any workplace exposures. But the gold standard for confirming COPD is a simple, painless breathing test called spirometry. For this test, you'll take a huge breath in and then blow out as hard and fast as you can into a tube connected to a machine. The machine measures how much air you can blow out in total, your FVC, and how much of that you can get out in the very first second, your FEV1. Doctors look at the ratio between these two numbers. A post-bronchodilator FEV1, FVC ratio of less than 0.7 confirms that you have a persistent airflow limitation, the hallmark of COPD. Your doctor might also order a chest X-ray or CT scan to look for signs of emphysema and rule out other problems. Blood tests can also be done to check for AAT deficiency, especially if you're young or don't have a history of smoking. While there is currently no cure for COPD, there is so much that can be done to manage the condition, relieve your symptoms, improve your quality of life, and lower your risk of serious complications. Think of management as a partnership between you and your healthcare team. The single most important, most effective step you can take is to stop smoking. It is the only thing proven to slow down how quickly the disease gets worse. Medications are a cornerstone of treatment. The main goal is to relax the muscles around the airways to make breathing easier. Bronchodilators are the go-to medications. They're usually inhaled and work by opening up the airways. There are short-acting ones for quick relief and long-acting ones for daily maintenance. For most patients with symptoms, guidelines often recommend starting with a combination of two different long-acting bronchodilators. Inhaled corticosteroids can be added, typically combined with long-acting bronchodilators for patients who have frequent flare-ups, also known as exacerbations. These steroids help calm inflammation in the airways. Other medications might include antibiotics for bacterial infections, and for certain patients with severe disease and frequent flare-ups, there are specific anti-inflammatory drugs like PDE4 inhibitors, or even newer biologic agents like dupilumab, which targets a specific type of inflammation. Beyond pills and inhalers, other therapies are just as vital. Pulmonary rehabilitation is one of the best things you can do for yourself. It's a full program that includes exercise training, education about your disease, nutritional advice, and psychological support. It's proven to reduce symptoms, improve your ability to be active, and boost your emotional well-being. Oxygen therapy may be prescribed for people with severe COPD and low oxygen levels in their blood. For a very small number of patients with severe emphysema, surgical options like lung volume reduction surgery or even a lung transplant could be considered. Living with a chronic disease like COPD is all about smart long-term management. A major goal is to prevent and treat exacerbations, those episodes where your symptoms suddenly get much worse. These flare-ups can be incredibly serious, often leading to hospitalization, and they can cause a permanent drop in your lung function. Managing COPD well means working with your doctor to create an action plan. This plan should cover which medications to use daily, which to use for quick rescue, and exactly when you need to call the doctor or seek emergency help. It's also vital to get your annual flu shot and pneumococcal vaccines to prevent infections that can trigger these exacerbations. Lifestyle plays a massive role. Staying physically active, as much as you can tolerate and often guided by a pulmonary rehab program, is essential for keeping your muscles and heart strong. Good nutrition is also key to maintaining a healthy weight and giving your body the fuel it needs to function. Finally, it's important to manage any other health conditions you might have, known as comorbidities, which are very common in people with COPD. These often include heart disease, osteoporosis, and depression. Taking care of your whole self is a critical part of your overall COPD care. Living with COPD has its challenges, but it is absolutely a manageable condition. The entire journey starts with recognizing the signs and getting a diagnosis. If you or someone you love has a cough that won't quit, gets short of breath, or wheezes, especially with a history of smoking, please talk to a doctor. An early diagnosis is the key to slowing down the disease and making your quality of life the best it can be. For more health information and to stay updated on conditions like COPD, please consider subscribing to our channel. While a COPD diagnosis can feel overwhelming, it is not a final verdict. Through a combination of quitting smoking, using the right medications, engaging in life-changing pulmonary rehabilitation, and building a strong partnership with your healthcare team, you can control your symptoms, stay active, and continue to live a full and meaningful life. Knowledge is power, and by understanding COPD, you can take charge of your breathing and your future. Take care and see you in the next video.